Hi Megan, my name is Caroline Ertman and I'm a nursing student at LR, and today I'm going to assess your cardiovascular system and your peripheral vascular system. Is that okay if I do so?
Yes.
Okay. Have you had any trouble with your cardiac system or your vascular issues or anything like that? Have you had any trouble breathing in your sleep?
No.
Okay. So first I'm going to assess your skin. It is an even light tan color. Then I'm going to check for any dyspnea, which is difficulty breathing, and I don't see any, so there's no sign of dyspnea. First I'm going to check the visual pulsations. I'm going to look at the aortic pulsation, which is located on the second intercostal space on the right side border. And then I'm going to look at the pulmonic pulsation, which is at the second intercostal space on the left side border. And then I'm going to look at the herbs pulsation, which is at the third intercostal space on the left side border. And then the tricuspid pulsation, which is located on the fourth intercostal space on the left side border. And then I'm going to look for the mitral pulsation, which is at the fifth intercostal space on the mid-clavicular line. And then I'm actually going to pulsate these areas. So I'm going to go to the aortic, which is the notch, second intercostal space, and then the pulmonic, right here, and then the herbs, which is about right there, and then the tricuspid, and then the mitral. And then I'm going to look at the point of maximal impulse. I'm going to check for, I'm going to check for the amplitude. It should be at the located at the fifth intercostal space on the left side border. It should feel like a gentle tap, which is the amplitude. And then the size should be it's about 1 to 2 centimeters, so that's normal. And then I'm going to check the Epigastric Pulsation. So where's your hands? I'm going to pinch right here and feel for any pulsation in the epigastric area. And I don't really feel that much of a pulse here. But I should feel for any abnormalities in this area. And then I would auscultate. I don't have a stethoscope, so I'm just going to explain what I would do and what I should hear. So with the stethoscope, I would use the diaphragm first to listen for any splitting or the intensity, and I'm going to listen for the S1 and the S2, which is the low dub sound. So I'd go aortic, pulmonary, herbs, tricuspid, and mitral. And then I would turn around turn the thing around and use the bell of the stethoscope to listen for extra sounds or murmurs and any abnormalities. So I do the same thing: aortic, pulmonary, herbs, tricuspid, and then mitral. And then I would turn the thing back around to the diaphragm, and listen for the apical pulse, and the rate should be in the range of the 70s. If they're an athlete, it could be lower, and if they're a smaller child, it could be higher, but it should be in that range. And then I would check for the peripheral vascular system. I would check the extremities. So I would check for the skin color first. So it's a light tan and it's evenly distributed. And then I would check for the appearance of the skin. So the appearance of the skin, there's no shiny spots on his skin, so that's good. And I would check the legs also. And then I would check for the hair distribution. It's pretty even on both sides bilaterally. It's even on his legs, and there's no uneven distribution, which means there's good circulation. And then I would pulsate these areas. Well, first I would check the size. So they're both the same size. There's no extremities that are uneven, so the legs look good also. And then I would pulsate the extremities. First, I would do this bilaterally, so I'm going to check his radial pulse, so follow his thumb, and I would use these two fingers, my pointer and index, I think that's the middle finger, and they are strong. And then I would go to, that's the radial, and then I would go to the brachial pulse. And then I would do the carotid one at a time, because I don't want to make him pass out. And then I would do the femoral, which, sorry about this, I'm cold. Give your hands a second. Which, I don't know if you can see it. I don't know how to hold this. It should be right. I'd have to figure scan. Should be in the crease of his legs. So right about there, and on the other side the same. And then I would check for the dorsalis pedis pulse in his foot. And will you hold this? And that's right here. Now I feel it on this side too. And then I would check the posterior tibialis pulse, which is right there. Alright, and then let's see. Oh, shoot, it's hard to hold. Then I would check the skin temperature with the back of my hand, so it's evenly distributed in his extremities. So I check his legs too, which I'm checking them with my hands. I might have to give you the phone again. And then I would check for, let's see, temperature. I would check for edema. So first I'm gonna check for edema in dorsal part of the foot. So I'm going to press for 5 seconds. And there's no sign of edema. And then I would do it in the shin. And then there's no sign of edema. And then the medial malleus of the foot, which is right here. And there's no sign of edema. And then, let's see, I'm gonna set it like this, maybe we will see it. Okay, then I would do the Holman's test. And this is to check for blood clots in the calf. So I'm gonna raise his leg like this a little bit, and then dorsal flex his foot, and if there's any pain or tenderness in his calf, is there?
No.
Then there's a negative Holman's sign. So there's no blood clot. And that is the end of the assessment.